Hi, welcome to Lecture 5, Public versus Private Goods in Health. Understanding how economic classification of goods affects health services delivery. First, let's have some definition. What are public and private goods? Public goods are goods that are, number one, non-rivalrous and non-excludable. Example, herd immunity. What this means is that when enough people have the immunity, even if those who are not vaccinated, they can also be protected against the illnesses. Other things will be clean air. There is no way you can exclude people from having clean air unless you sell the air in cans, things like that. For example, defense. Defense is again a public good. You cannot exclude people from having defense to say that I only defend certain people but not the other groups. These are some of the things that are considered as public goods. Private goods, on the other hand, these are rivalrous and excludable. For example, prescription medication. You can have a prescription medication, but unless you're in a country where there's universal healthcare, you have to pay for your prescription. Okay, even if it's free, you still need to queue for your prescription. You still need to see a doctor to get a prescription. So all these things that means they are considered as a certain sort of private goods lah. Same thing as surgery, especially if you are in a set in a system where you have to pay, whether it's out of pocket or whether you have to pay the full amount. This is things that can be excluded. What about merit goods? Okay, merit goods are goods that are under consumed. People don't usually use it if you left to the market. This is where market failure. There's this concept of market failures. For example, vaccination, preventive screening. All these things are good for you, but if there's no forces to encourage people to take it up, they may not. So that's the reason why, since it's very good, government has a huge incentive to subsidize or to even make it mandatory. For example, I think if not wrong, measles is mandatory for entering a school. So these are some of the things that the government can do to force people to actually go for measles vaccination. If you don't go for it, you cannot attend schools. What are the implications for health system? Obviously, public goods need collective financing, which means that since it's not excludable, the probably best way is taxation. Can you imagine if all of us have to pay privately for the police force? That would be ridiculous, right? That's actually security guard. So for certain buildings, they can actually hire security guard to protect their property. But when you talk about the whole police force, security of a country or a region, it's not. It's actually financed through taxation. Private goods, on the other hand, is left to market mechanism. It's not because the market works well all the time. It's just that in certain cases, the market is the best distributor, and if the market doesn't work that well, government can then intervene. And merit goods, again, you need to have policy intervention. Otherwise, people may not go for it. For example, vaccination, because there may be some risk, and the benefits may be just they may be unclear benefits. So this for these merit goods, they may actually require policy intervention. Now talk about this thing I learned in my MBA: search goods, experience goods, and credence goods. Why this is important is what is search goods? Search goods are, for example, books. Quality is known before you use it. It's the same everywhere. Spectacles, in a certain extent, can be considered as that. So for search goods, you can buy online, okay, because it's the same, okay. Spectacles wise, if you do know what you want, maybe for those old age glasses, I think you consider as search goods. For experience goods, you only know it's good after you use it. So how this applies is that, for example, for clothing, you only know it's good for you if you can try it and wear it. So if you want to have this in the to be sold online, you need to have a very generous shipping. You have a very generous exchange policy, so that people can exchange it. Otherwise, the barrier is that they have to try it before they use it. So they may rather go to the shop to actually try it. That's then they will actually use it. For example, certain therapy lah. If it works, for example, you see a doctor and they will give you some medication and you recover. That's considered as experience goods. Okay, this is credence goods. Credence is very interesting. Credence goods is things that even if you try, you still may not know it's totally well. For example, you see a doctor, they give antibiotics, but it's a viral infection. True, you may not need the antibiotics. In the end, it got better, but actually the care is not that good in the sense that you're given antibiotics for a viral treatment rather than bacterial treatment. So other things like surgery, you don't know whether surgery is done to the best of its ability, and because there are a lot of complications that may be present, but you may not be fully aware of. Diagnostics, similarly, there will be things like over testing. Do you over test for certain things? You may not really know whether the quality is there. Yeah, so these are some of the things that you can consider. Okay, why this matters in health economics? Obviously, number one, healthcare contains credence goods. So a lot of times, even if you try the goods, you're not sure it's good or not. After you're admitted to the hospital, you're not sure whether the care is appropriate or not. That's why there's a growing focus on prompts and prem. It's not that prompts and prem are not important or accurate. It's just that we need to see from the patient point of view how is their experience and how is their outcomes. So for those who are not familiar with, PROM is patient reported outcome measure, PREM is patient reported experience measure. Due to information asymmetry, this is something that we need to really resolve. So that's why patient education is important, so as to reduce the information asymmetry. Public goods and merit goods justify public financing. That's why a lot of times, a lot of government, they will actually fund childhood vaccination. Because if you vaccinate enough, there'll be herd immunity. So even if some people fell the cracks, don't go for vaccination, it doesn't spread. So recently we read the news. I think US had a few cases of measles outbreak. I'm not sure whether is it fully subsidized or is it mandatory. But increasingly more and more people are opting out of vaccination. And finally, once you classify the goods, it helps to inform policy and payment decision. So for example, search goods, how it can work is that it's the same. So for example, they may not really want to really shop around because you know what is it like, and then you may want to just pay a certain rates. But for certain outcomes like surgery, you do not know how good the surgeon is. You may not want to have a one-size-fit-all payment. So this is one of the criticism for certain healthcare system where they give a fixed rate for the thing because the care is different. Some doctors may spend more time, some doctors spend less time. I think it's oversimplification if you just use the one size fit all fee payment for the services. Yeah. Okay, thank you for listening.